We'll get started. A very good afternoon to everyone, all the guests, faculty, and students of IIHMR as well. I am Raghav, and on behalf of Healthcare Continuum, would like to welcome you today to this inaugural session of Healthcare Grandmaster series. This initiative is not just an educational series, but rather a bridge that is aimed to connect you with the forefront of global healthcare insights with sharp minds that we have on the call today that will define the future of healthcare in India and beyond. So very warm welcome to everyone to join this inaugural session, and we look forward to your continuous participation in future as well. Our partnership is with IIHMR for driving this initiative, and we are privileged to have Dr. Pankaj on behalf of IIHMR and many other faculty and students joining as well. This partnership is crucial because it enriches the level of scholarly depth, the rigor and expertise that IIHMR has, with practical know-how from the industry that we want to discuss today. It is aimed to ensure that what we learn translate into deep actionable knowledge that translate into a real-world applications and impact. This is our commitment to make sure that new generation face the intricate realities of healthcare. We were just talking about few of them while we were waiting. Some of the realities, not just India, but at a global level, but also the complexities and nuances of the healthcare landscape locally as well as globally. So I'd like to introduce Dr. Pankaj to share a few words.
Right. Thank you. Thank you so much, Raghavji. So at IIHMR truly believe that it's very important to interact with the industry. We have been here in Delhi since 2008, and it's not just academia per se. As Raghavji said, academia industry collaboration is very IIHMR, and so. We started in 2008. Probably we were the first institute which were offering health informatics courses. And we always knew that technology would play a very important role. And this is what we actually try to impart in our students as well. And as we are talking about strategy, strategy in healthcare is it's like navigating a complex maze with precision and foresight. I think Gaurav would be the best suited person to actually take this forward. But it's a pleasure being here, and we are very happy to collaborate, and we look forward to enrich this partnership, right? So thank you so much for having me, and Raghavji, please. Thank you.
No, thanks a lot, sir, for sharing those wise words. Without further ado, I'd like to introduce to Mr. Gaurav Agarwal, sir. We are privileged to have him as part of the kickoff series with his luminary insights. He's a luminary in the medtech field as a managing director of Innovolution Healthcare. Under his leadership, Innovolution has emerged as a beacon in innovation in medtech sector. His work has been instrumental in strategizing the growth of medtech exports from India, bolstering local manufacturing and spearheading initiatives that have placed Innovolution at the forefront of cardiac device market globally. His insights today will not only enlighten us about the journey he has taken through this amazing success, but which is quite an untold story, and myself looking forward to hear more about it. But it will also guide our future healthcare leaders on how to navigate the impact of evolving healthcare and medtech landscape. So, as you know, India is at the cusp of 50 billion medtech industry boom, and to realize this potential, we welcome you all to keep this as an interactive session as Gaurav sir takes it forward. Put your questions in chat, and we'll look forward to have it enriching and engaging discussion today. So, without further ado, Gaurav sir, warm welcome. Thanks for taking out time today, and I'll hand it over to you to take it forward.
Very good afternoon, Raghav, and thank you for the very generous and kind introduction. Very good afternoon, Dr. Pankaj Talreja. We had a chat on the sidelines. Really enjoyed exchanging thoughts with you. And Manishji, thank you very much for choosing me to open the Grandmaster series of these talks. I hope I'm able to do justice, and if I'm able to even inspire one student to follow the path that we've taken, I think I would consider this chat to be time well spent. So over the next 25-30 minutes, I will intend to walk you through the journey of involution that we started about 12 years ago with all sincerity and with utmost honesty. So should we start, Raghav? I mean, I hope my screen is visible. So very good afternoon, all those who are attending. Thank you very much for being a part of this chat. And I would just like to say this to begin, especially to the students of IIHMR, that I'm a student amongst all of you. Don't treat me differently with just 30 years of experience. So I would like you to consider me no different. I just have added 30 years of experience compared to you. 30 years ago, I was also a student sitting in a classroom in Manipal, and I completely empathize with the anxieties that you have today, the questions that you may have, the plans that you have for your future, and also the uncertainties that the future holds. So I hope I'll be able to address most of those. And I had requested Raghav to keep a slightly longer time for question and answers. And I hope I'll be able to answer your questions to the best of your satisfaction. So this journey of involution very interestingly began in end of 2010. Before I go there, I'd just take a minute to introduce myself. I belong to the very first batch of biomedical engineers that the country produced from Manipal, passed out in 1996, and went on to work with various multinational companies, earlier in application and service. And then very quickly, I realized that I wasn't great behind machines. I was better in front of people. So switched from being a service engineer and an application engineer to a sales and marketing professional. And then I spent a very long period of time at a leading global multinational company called Abbott Vascular. Abbott Vascular is an American multinational company, which is even today the largest selling stent company in the world globally. And in my last role with them, I was the marketing manager, Asia Pacific. While there, I completed my executive MBA at IIM Kozhikode, and I also went to Kellogg's for a short leadership course. In addition, I also led a lot of initiatives at Abbott on therapy development and training. And in 2010, I was fortunate to lead an Indian multinational company by the name of Merrill Life Sciences. Today, Merrill is the largest Indian medical device company with valuation of over $3 billion, having been funded by Warburg Pincus and revenues in excess of 3,000 crores. I think the scale that they have in the country, and I was fortunate to have started that journey in 2010 with them. 2011, we co-founded Innovolution, and that's exactly the journey that I'm going to talk about. So this is who we are today. We are a cardiovascular care-focused company. The journey began, as I said, in late 2010. Today, we are among the top 1% of India's medical device manufacturers, targeting 500 plus crores in revenue this year. We have 4 manufacturing facilities in India, 2 in Visakhapatnam, a large stent manufacturing facility in Jaipur, and a cath lab manufacturing facility in Bangalore. We're also Asia's most awarded cath lab manufacturing company. We have won 13 awards of repute, national and international both. The most prestigious ones being Red Dot Design Award, which is considered the Grammy of or the Oscars of industrial design. We've also been awarded by the President of India for being among the top 15 most innovative companies across sectors in the country. We were also the Medical Device Company of the Year in 2020 by the Government of India, alongside some giants like Cipla and others. We're also India's top angioplasty balloon selling company, and we are among the top 5 stent selling companies in the country. So this is a very quick introduction about who Innovolution is, but these are just numbers. I would like to tell you a very interesting story about how we decided. I was doing extremely well as the CEO of some very large multinational corporations. And one day, I was in Apollo Hospital, Chennai, and there was a very handsome young man, 35-year-old. He walked into the cath lab. His wife was just saying, "Darling, just go for an angiogram." And they were a beautiful, very wealthy couple. And he said, "Don't worry. I mean, we'll go out for lunch." It was about 12 in the noon. And he said his doctor had recommended him to go for an angiogram because ECG had revealed some disturbances. And he was an Apollo, very healthy, handsome young man. He walked inside in the hands of one of the best cardiologists in the country. And 6 minutes later, I went inside the cath lab and I found that due to an extremely rare complication, he had died on the table. You know, a man walks in alive and he walks out dead, 36-year-old man. And that is when I decided that we are going to be part of this industry, serving this industry to the best of our capability. And every story, unless it becomes personal or unless it becomes experiential, is not going to be successful. You know, so that was the turning moment for me when I decided that serving cardiovascular care in the country is what I will do for the rest of my life. And that's exactly what I've done. Out of 30 years, 28 years have been spent serving cardiovascular industry. And till I hang up my boots, this is what we intend to do. Also, another very strange but true statistic is that India has about 80 million patients suffering from cardiovascular disease. And we lose about 4 million patients to heart failure or heart attack or some sort of cardiac disease. Imagine we lost about 500,000 patients to COVID and it wreaked a havoc for 2 years. We lose 8 times that number of patients every year to cardiac disease. So our goal is to truly democratize cardiac care in the country and make in India for the world. And this is exactly what I intend to cover over the next few slides. This is a little bit about me. These are some of the accolades and awards that we have won, and I'd leave the screen on. It's
Is there some issue?
Yeah, Raghav, we just can't hear Gaurav.
I think
Or he's left, or how is it?
trying to see. I don't see Gaurav sir here actually. It's somehow.
Yeah, just that he.
Can you hear me? Can you hear me?
Raghav, please admit him. He's there. He's joining again.
Oh, okay.
Yeah.
Sorry about the disturbance.
Yeah. He's back. Raghav, please call him up.
I'm very sorry I got thrown off, some technical challenge,
Hmm.
but this is the beauty about technology. It works 99% of the times till you want it to, right? So is the screen visible still?
Yes,
Very
yes, yes,
Gone
Gaurav.
off somehow.
Absolutely
Yeah,
visible.
yeah.
No,
Okay.
I mean, we can see you, but we can't see your PPT.
Oh, okay. Just give me a second.
Now we can. Now we can.
Yeah.
So a journey, as I said, started in late 2010, and that was also another very interesting story. We were, me and my partners, we were on a train from Paris to Switzerland, and we were working for Merrill. I was heading Merrill, and my regional managers with me, and they said that, we've scaled. By that time, we had taken Merrill from about 8 crores in revenue to 32 crores in 2010. And they said that, we work for large multinational corporations and we've tasted success with an Indian multinational. Why don't we do this ourselves? And that is literally, we wrote the idea of Involution on a cocktail paper. And that's how, on a train from Paris to Zurich, Involution was born, quite literally. And 5 months later, we were a company. So our journey began with a boutique interventional cardiology company based out of Netherlands called Orbis Niche. We started our journey by distributing their balloon catheters. And in 2011, we launched our own stent brand. In 2016 was the most important milestone in our journey, where we decided that we will consciously step away from distributing products made by others to building our own and producing them ourselves. And that is when we signed a joint venture to form Cath Labs. It was a very audacious step because there are only 8 manufacturers of Cath Lab around the world. And building such a high-end medical equipment was a very audacious decision. But we started that journey in 2016. It took us nearly 18 months of research to launch our first prototype called the Pinnacle. And in 2018, we also won the prestigious Red Dot Award in the very first year of launching our Cath Lab. In 2019, we won the Good Design Award, which is a very prestigious design award by the Ministry of Commerce, Japan. And we reached 100 installations. So just for the audience to sort of put this in perspective, there are about 2,700 Cath Labs installed in India. And we started our journey in 2018 mid. And by 2020 was a write-off year because of COVID. No hospitals made any CapEx decisions. In less than 2 years, we had installed 100 Cath Labs in the country. In 2020, in the middle of the pandemic, we won the India Medical Device of the Year award from the Department of Pharmaceuticals, Government of India. And in 2023, we installed 300 Cath Labs. So in 2 years, we accelerated and we installed 200 Cath Labs in the country. We today have about 8% share of all the installed Cath Labs in the country. And we also received our Series A funding by OrbiMed, which is one of the largest healthcare-focused funds in the world. In 2024, we received another very interesting and satisfying distinction. We got certified a great place to work, which is awarded to less than 1% of all companies in the world. These are our manufacturing facilities. In Vizag, we have in AMTZ, which is now proudly the world's largest medtech cluster. where a CT scan and an MRI and a cath lab are all built under the same roof. We're proud of being part of that ecosystem. We have an export-oriented unit for cath labs at AMTZ Vizag. We also have our stent delivery system manufacturing unit there. Jaipur, as I mentioned, is a stents manufacturing unit, and Bangalore is a cath lab manufacturing unit. So this is a quick snapshot of our team. We have 450 members spread across 30 cities, 90 people in sales and marketing, a dedicated 35-member R&D team based out of Pune, 15 people in new therapy development, headed by a PhD from IIT Bombay, and a very large after-sales support team. These are some of the awards that we won along our journey of about 12 years. CII Design Excellence Award, Good Design Award, India Medical Device, Frost & Sullivan Best Interventional Practices Award, Top 10 Startup Award very early in our journey, Most Promising Company of the Year Award, Best Brands ET Asia Award, and a few more. So it's been a very gratifying journey that an Indian company, the challenge for Indian products typically, and we have some leaders who've cracked the code better than we have. Indian products were always considered to be at par technologically or in terms of their features, but especially for medical equipment, they lacked the global design language and appeal that was needed to take your product to shores outside India. And that was one of the design goals. We had 4 design goals when we built our cath lab, and making the most aesthetically appealing cath lab in the world was one of them. To that end, we have won every single design award in the world that there is. And it was a very, very unusual goal for a company of our size to have, but we're proud that we did it. And today, when we display our product at various international trade exhibitions, it is received extremely, extremely positively. Now, that was actually in a nutshell our story. And going forward over the next 2 years, we are now a public markets bound company. We intend to go IPO in sometime in 2026. We are targeting revenue in excess of $100 million by 2026. And we hope to have presence in about 52 countries by back half of 2026. We already have a subsidiary in Singapore. We intend to open subsidiaries in Latin America and Brazil, in Europe and Austria, and a subsidiary in Dubai, catering to Middle East and African markets. So that's a little bit about us. We continue to remain focused on every product or service that feeds a cath lab. I have seen a lot of Indian companies that have multitude of products but are unable to acquire scale and size. But we are a 3-product company as we speak today, and we are nearly 500 crores in turnover. So we've remained extremely true and focused. We have a very popular hedgehog strategy. And that hedgehog strategy says that the best companies in the world, do only what they know doing best. So if you can't be among the top 3, don't attempt that market. And we've truly followed that hedgehog strategy. And the solutions and therapies that we intend to bring over the next few years are also targeted at serving cardiovascular disease or vascular disease in some form or shape. So with that, I would like to end my presentation, and I'd like to open this session for any questions, if there are.
No, thanks, Gaurav sir. This is a very inspiring journey and very multi-hopping, I would say. But I'll let folks ask questions in the chat, or maybe just unmute and ask their questions, thoughts.
Gauravji, this is Rajiv here, Rajiv Chabbar.
Good afternoon, Rajiv ji. Of course, I know you very well.
No, not. No, excellent journey, Gauravji. And we're really, really proud of Involution, and everywhere where we go, I think not only me, but the leadership at SMT also, whenever we have to mention at least someone who's doing a similar kind of rigor, which takes India to the next level itself, it's Involution itself. So that's
Thank you.
it. But one thing that we've been grappling, and I think it's common for all domestic companies, is when it comes to bringing the quality aspects to it, the harmonization of this entire quality paradigm is really taking a toll on India. We have moved from a from L1 to now value-based procurements, but this is something that I think is what needs to be really, really taken forward with a with 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 not only torchbearer companies, but also with a zeal that the government also takes forward the entire spiel of how Make in India and Made in India for the world needs to be embarked. So your thoughts on how we could take it forward, and obviously when we connect at various forums, whether it's government forums or others, we'll be echoing the same.
Right. I mean, I think you very rightly mentioned that Indian companies today are facing a challenge where, we are facing a quality paradigm shift. People are waking up to the fact. So I think Sejanand, coming from leadership team of Sejanand, there couldn't be a better person to ask this question. Sejanand, for those of you who are not aware, is a torchbearer of high quality Indian medical devices. I think 60% of their revenue today, about 450 or 500 crores out of 800 crores, comes from international operations. This is not easy. They sell their stents to over 90 countries today. And I think it's because of companies like Sejanand and some others that have paved the way for companies like us. We're not blazing a trail. They've blazed a trail for us to follow. So talking about the quality, I think quality is the road to success is always work in progress. And, you can't say that we've arrived at cracking the quality paradigm. Do I hear some video? Is it only me or is everybody able to see? Oh, okay. I'm sorry. So as I said,
we just got hacked by someone, some spamware. That's the tech, another glitch here, but sorry about the inconvenience.
There were some Chinese army men that we saw stomping. Okay, anyway. So what I was saying is that, especially for a complex medical equipment like ours, cath lab especially is a very, very tough, a very demanding imaging area, because it's the only therapeutic area. It is the only equipment which is diagnostic as well as therapeutic. If you look at ultrasounds, CT scans, MRIs, they're only diagnostic. So they are far less, so customers are far more tolerant in terms of breakdowns. But we are in an area which is not only diagnostic, but also therapeutic, and that too in a life-saving area. So we're constantly upgrading our safety standards, constantly upgrading our imaging standards, constantly doing reliability engineering testing and value engineering to ensure that we provide the most reliable cath labs that can be built, but it's always work in progress.
So
Thanks,
if you can
Gaurav-ji,
stop sharing the screen, maybe people can have a more enriching dialogue.
Sure.
Yeah, great.
So Gaurav-ji, I request you to cover your strategic landscape and just 5 to 6 strategies that have built IITPL what it is as of today.
Very interesting question.
Yeah, because I know the way you came, came from your say professional journey, and it was not easy actually, because it was very uncertain, a scenario all around, and then where maintaining your confidence and take and being assertive, and the kind of medtech your products are in, and especially the competition from the MNCs, it was not an easy actually. So I wish if you could just share a couple of strategic,
Sure. So I'll tell you, the first was hedgehog strategy. We truly believe that the founding partners of the company have spent over 100 years in the interventional cardiology space between me and my three founding partners. So this is an industry that we know best. This is the area that we are most passionate about. And after balloon in 2011 to 2016, I think cath labs and stents was the next natural progression. So first was clearly the hedgehog strategy. We only entered areas that we knew best and where we had an opportunity to excel and make a difference. The second was, again, focus. Along the way, we had many opportunities to enter lateral areas or adjacencies, product adjacencies, therapy adjacencies. But we saw a lot of Indian companies falter there. You need to get better before you become bigger. And that is something that we follow truly. And unless we are able to reach a level of quality and a level of competitiveness where we feel that we can compete with the big boys, the biggest boys in the game, neck to neck on quality, we will not enter another therapy area. So I think we've broadly reached that stage. And over the next 2 to 3 years, we are investing a lot of R&D dollars or R&D rupees to enter about half a dozen new therapy areas, but they're all related to vascular disease again. We are not leaving the cath lab space. Anything that feeds a cath lab is of interest to us. The third is Dhirubhai Ambani had very, very famously once said that I want share of 70 rupees, that for every 100 rupees that an Indian spends out of his wallet, I want 70 rupees out of that. So taking a cue from that, we want to take 70%, we want to at least play in 70% of every product that a cath lab consumes. Just for reference, everything that a cath lab consumes, from diagnostic to imaging to neurovascular to peripheral vascular to a lot of adjunct therapies, that market is about $2.5 to $3 billion in India alone. And globally, the medtech device industry is about $500 billion, of which we are only $12 billion. We are less than 3% of the global medical device market. So if we are only able to crack 70% or participate in 70% of what a cath lab consumes and are able to make in India for the world, I think for the next several years, we'll have market leading growth. So I don't know if that answers your question, Manishji, but
that's a great answer. And okay, so 70% is what? Yeah. And
that's the aspiration.
that's aspiration, yeah. And which is the market actually? Do you also have any yardstick like, ROI per market? Cost of servicing a customer, varies from, geography to geography. So any such strategic, say benchmark you have in the back of your mind, because again, yes, I understand the strategic landscape as of now, but again, you have to choose the markets you would like to be in, in terms of their comparative ROIs.
Absolutely. So Manishji, international business, especially for capital medical equipment, is a very challenging pathway to navigate. And I'll give you an example. We have about half a dozen systems installed internationally, cath labs, and our average cost of servicing them is nearly 7% of our revenue.
Okay.
The cost of installation is about 3.5 to 4%. And our only goal when we go international is that in India, till now, what we do is we have 380 installed cath labs in the country today. We go to our prospective customers and give them that list and say, find us a dissatisfied customer and we'll not sell a cath lab to you. We have industry leading uptime of less than, or industry leading downtime of less than 36 hours. No breakdown is ever attended or not fixed in under 36 hours. And we have 91% customer satisfaction score across 350 installed cath labs. That is the benchmark for us, that every market that we serve in India or anywhere else in the world, we need to maintain the same service level agreements. Our customers need to have less than 48 hours of downtime, and there needs to be 90% plus customer satisfaction across 40 parameters of performance.
Okay.
So if we can't meet those obligations, we'll not enter a market, no matter how lucrative.
That's really insightful, actually, because we are we are always on the this mission that how many machines we can send, but nobody gets into such nitty-gritty of servicing a market, and especially overseas market.
These
So
are
it's actually a
life-saving medical
different
equipment,
approach.
Maniji, and I think this cannot be only looked at as a business. This is truly life-saving. Imagine a young patient on the table and your lab breaks down and you're not able to fix it. Lab is a machine, ultimately. It will break down, but your response to that breakdown needs to be super urgent. You need to have super trained engineers. You need to stock service spares in every country that you go to. And fortunately, till date, we have not lost a single patient due to the machine's fault. Till date, we have over 700,000 procedures, 700,000 lives touched on our cath lab so far. Not a single death due to malfunctioning of the equipment.
Oh, that's amazing to hear, sir. I have few questions taking you a little back in time. You already talked about when you
Sure.
were starting out as a fresh graduate. What advice would you have for fresh graduates coming out of college today, especially keen to making impact in healthcare, medtech space, especially in medtech? What advice would you have for them?
My advice to everybody will be that rough roads lead to beautiful destinations. Don't follow the charted course. It'll only take you to destinations that are known, where everybody has been. And I'm an example. When I started biomedical engineering, my father was based in a small town called Kanpur in UP. And though he was a very high-ranking government official, he said, Beta, I've asked Gupta ji, Sharma ji, Verma ji, all my colleagues, nobody understands what this biomedical engineering is. Are you sure this is the path you want to take? And I could understand his anxiety as a father, but I took that path. It was the very first time this course was being introduced in the country. And there was such a huge talent deficit that somebody who was a very mediocre student like me also found favor and success. Then at the top of my game, when I was heading Merrill Life Sciences, I was making 7-figure salary, was flying business class, was staying in the fanciest of hotels, meeting some of the biggest customers worldwide. I decided to start again from scratch. Was not easy, was extremely tough. I took a haircut of about 80% on my monthly salary just to get the company started. And not only I did that, the rest of my partners did. But today, the kind of satisfaction that we have is absolutely unbelievable. If I were to live my life all over again, I'll do the same things. So my advice is that the only shots that fail are the shots that you don't take. So medical device, especially as Raghav said, we are going to be a $50 billion medical device economy by 2030 from 12 billion odd dollars. This kind of phenomenal growth in a decade is not seen in many sectors. So if you join this industry now in the golden decade, over the next 2 to 3 years, regardless of what you do, even incremental growth every year will get you big gains in the next 10 to 12 years.
Totally, sir. I see Vineet, sir, have a question. So you want to unmute and ask question?
Yeah, Gauravji, wonderful session. What an inspiring story you have. I have a simple question. You mentioned about adjacent areas, and I appreciate your focus on the areas which you know the best. But I'm curious to know whether you regard moving towards preventive side, because of course you treat patients which are very, very critical. Would you like to consider moving towards prevention or towards that side and do something about and create some similar marvels in on that side of healthcare?
Absolutely. I mean, as long as it's related to cardiovascular disease and its diagnosis, absolutely. I think we share the goal. Sejanand, for example, had a tagline, committed to save billions of lives. I mean, what a wonderful tagline to live by. We have the similar tagline. I mean, we want to democratize cardiovascular care in the country. It could mean prevention, it could mean therapy, it could mean post-treatment care, any of these.
Wonderful.
Dr. Pankaj, you have any question?
We have a question from Priyanka. Coming to you.
Yes. Thank you, Raghav, for the opportunity. Thank you for sharing your journey, Gaurav sir. It's been truly inspiring. In fact, the journey pertaining to Innovolution, because it's really inspiring to know how Innovolution has grown over the last decade. I have a couple of questions. You can probably pick if you want to. My first question is what are the strategies that Innovolution employ to decide which innovative projects to invest on?
Very interesting, multi-layered question, Priyanka. Thank you for the rich compliment. One of the things that we did, for example, on the cath lab side, when we brought our cath lab in 2018, we were perhaps the only cath lab of our size and in the price segment that was offering digital stent enhancement. When you place a stent inside an artery, sometimes plain vanilla imaging is not enough to see the contours of the stent, and you need to do something called digital stent enhancement to see whether the stent is well opposed to the vessel wall. In 2018, that was offered only by Philips and Siemens, not even GE. And we came up with our own digital stent enhancement feature, and that set the market by storm. And we were 40% cheaper than Philips and Siemens. In addition, we brought some features that Philips and Siemens didn't have even in their high-end labs. We came up with a single 55-inch monitor, which had programmable real estate. So for example, this screen, you can see about 13 thumbnails. We had a fully programmable screen, which was first in the industry, and the market was, again, could not believe what we were trying to do. And eventually today, everybody has moved to a single monitor. Earlier, you used to have 5 monitors in a frame. We also employed some very innovative strategies. For example, we knew that Innovolution, no matter how successful a product it brings, will not be able to compete with brands like Philips and Siemens. Brands are built over a long period of time, and we were starting our journey. So we had to be cost competitive. We started with about 88% import content in our cath lab in 2018. Today, I'm proud to tell you that it's under 40%. We are the only company in Asia that does its own C-arms. A C-arm is almost 1,500 kg metallic part, which is at the core of the cath lab and any other imaging equipment. We do our own casting. We do our own vacuum die casting. We do our own fabrication. We do our own machining. We do our own painting. Because for the volumes that we had, automobile industry didn't find us attractive. We had small volumes. And for small vendors, we didn't find them matching our quality standards. So we decided to do it all on our own. And very recently, we launched some cutting-edge AI-driven features where the diagnosis of coronary artery disease can be made simpler. And I'm proud to tell you that this is a feature that's only available on our cath lab. It's not available with any other cath lab in the world. We are launching it in June. We've co-designed, or we have exclusive rights. This is designed by a Korean company, and we are going to be the first company to launch it on our cath lab. So several such technological initiatives, and you'd be proud to know, Priyanka, that 62% of our team are ranked freshers. People who have absolutely no experience, neither industry experience nor work experience. And they do such an amazing job in 6 months that they train with us that we intend to take that number to 70%. Also, for a heavy industry, our machines typically weigh 15 to 1800 kgs. we have about 30% women in our workforce. 22% of them are freshers, fresh biomedical engineers, fresh electronic engineers. So we do the same thing, but we just do it a little differently.
Yeah, I might happen to know one of them, one of the freshers you're talking about. In fact, that is what motivated me to take up this talk, because I wanted to hear it from you, your journey, and the journey of Innovolution, in fact. I'm a supply chain professional, and I just want to understand from your perspective or Innovolution perspective, what kind of challenges did you face? So when COVID hit, which was an unprecedented event, what kind of challenges did Innovolution face, and how did you navigate through it?
So very challenging times. When COVID hit, we were not only hit by supply chain disruption, but we were also hit by a massive disruption in supply chain of chips. There was a global chip shortage because suddenly a new animal was consuming chips like they'd never before. Cars are now computers that you can drive. So, the worldwide consumption of chips just went through the roof, and medical device industry suffered, especially on the imaging and electronic side. And that is when we decided that so one of the things that we did was we had less than 5% Chinese content to begin with. And post-COVID, we have 0% Chinese content in our cath labs. The only parts that we were getting vacuum die casted were some plastic parts because they have amazing turnaround time. To put it in perspective, something that gets done in 6 weeks in India, they would be able to provide us in less than 5 days. Shipment time included 2 weeks. So 2 weeks versus 6 weeks, that was the turnaround time. So supply chains were massively disrupted. We started building our own UIs. We started building our own keypads. We started building our own tablets, not our own, but we started sourcing them from India, encouraging small vendors to build to our specifications. And today we have less than 40% imported content, and we intend to get to less than 25% over the next 3 years.
All right, thank you. My last question to you is in terms of sustainability. I believe a lot of organizations, in fact, across different industries are now moving towards sustainability. So I want to understand what steps is Innovolution taking to ensure its operations in a more responsible manner? If already taken, what are they, or do you have any plans of sustainable strategies?
Wonderful. So we are now moving to one of Asia's largest cath lab manufacturing setups, 160,000 square feet facility. And I'll answer your question in just one sentence. We are targeting LEED Platinum certification for that, which is not easy for a heavy industry or heavy machine manufacturing company, but we are targeting LEED Platinum rating. Sustainability, we are using fly ash instead of raw bricks. We are using rain harvested water. The site that we have had about 250 trees. For every tree that we are uprooting, we are planting 4 trees. And several other sustainability features. For example, we are not using VRV air conditioning. We are using dual brick cooled systems in some parts of the facility. We are taking advantage of the beautiful landscape and using a lot of natural sunlight and air. We are making open air meeting rooms, cafeterias. So sustainability is at the core of every project that we do in future.
That's amazing. Thank you so much for your time, Gaurav sir. Thank you, team, for the platform.
Very smart questions, very well structured. Wait, I'll come back.
Some of these were out of syllabus actually, but thank you.
That's all. So Priyanka, let me also tell you about very good to note, like Innovolution is ESG compliant, getting much more ESG compliant, no doubt about, because ESG is going to be repurposed or is being repurposed as a regulatory barrier and trade barrier as well, right? So very smart questions. Good, great going. Gaurav, I have a very a different question, and I think it would also be kind of out of syllabus. So, Make in India is great. How does it appeal in international market?
I think thanks to companies like Sejanand and Merrill, we are shining on the global stage, quite honestly. When you go to large cardiology congresses, it's no longer an American company or a European company that has the largest booth and the presence.
Okay.
It's the cluster of Indian companies. And we're actually at the same time that pharma was in the 80s.
Mm.
In the 80s, pharmaceutical started the journey towards generics, and today we are the pharmacy of the world. I can tell you very confidently that by 2040, we'll be the medical device hub of the world.
Very good.
Amazing.
So
Sir,
we're early in that journey, but very firmly and surely.
Great.
amazing. Very glad to hear, sir. I think we have few more questions coming in. Varun, sir, do you want to unmute and ask your question? I know you typed in chat as well. Mr. Varun. Maybe let me read out, sir, question. Want to get your perspective on other parts of medical device industry. What are they shaping up like, especially in single-use medical device? We are still dependent on latex, like urinary catheters and gloves and all. Maybe Varun, if you want to elaborate further, feel free to unmute and ask.
Sure, it's a good question. I think with companies like Polymedicure and HMD, and we have some very large plastics manufacturing companies in medical grade tubing. Applications can be varied from cannulas to catheters to drainage catheters to central line catheters. There are multiple applications, but I think the only listed company in medical devices is Polymedicure. And to tell you, they have the highest multiple on revenue. They trade at 22x multiple of revenue. Okay, so they're a rock star of the Indian stock market. There are very few peers that they have, not only in healthcare, but across board. So, I mean, I hope that answers your question. There are manufacturers of medical grade plastic tubings in India, and they're doing extremely well. In fact, Polymedicure, 65 to 70% of their revenue comes from exports.
So one question I had was that as you navigate the global market, what kind of regulatory or compliance hurdles do you see, and what variation do you see across markets, as thinking from a new product, someone building a new product, trying to scale up globally?
Yeah. So the most important milestone for an Indian company is to comply to IC standards. If you get C certified out of 190 odd countries, you can do business in about 125, 130 odd countries, with some local regulations that you need to clear, but those are just incremental testing requirements or incremental documentary requirements. Now, if you've set your sights really big and you want to enter mature markets like Korea, Japan, Australia, US, China, then those require a completely different regulatory pathway. Sometimes they require partnerships. Sometimes they require you to change your audit processes, manufacturing processes, your testing processes, validation processes. So barring these 6 or 7 large countries, if you're CE marked, broadly it opens the doors for about 80-85% of the countries by number. I mean, by volume and by revenue, US consumes about 50% of all medical devices worldwide.
No, definitely. No, thanks for answering that question. Any other questions from the group, or any thoughts, ideas want to share?
Gauravji, what is your take on mobile cath labs? How do you look at that kind of intervention?
Well, mobile cath labs were a good starting point, but they failed on many counts or on many promises that they were launched on. The first and foremost promise that they made was that they could be fit into the back of a van and they could be taken to remote villages. But that couldn't happen, from a radiation safety standpoint, one, and also from an image quality standpoint. When you're doing X-ray imaging of the heart, which is a pulsatile organ, you need extreme precision. And in an environment where there is a lot of shake and a lot of blur, and a lot of vibration, it's not possible to achieve the quality of imaging that you need to do a heart intervention. So mobile labs worldwide are a dying breed. Miniji, I hope that answers your question.
I said very well articulated. Yes, it makes huge sense. The basic fundamental things,
Exactly. I mean, imaging of bones, etc., is simpler because you're imaging a static object, but heart is a pulsatile object, sometimes moving at 70 beats per minute or higher. And the imaging sophistication required to recreate that image is very different from any other organ of the body.
No, this is great, sir. Dr. Pankaj, any thoughts from your end?
No, I just I've been awed by the journey, So whatever I've been hearing, it has awed me. So on a lighter note, when are you planning an IPO now?
I just mentioned, hopefully, fingers crossed, before we say bye to 2026.
Okay. Okay. So you're on that path. And from IHMR, I would like to invite you on our campus. When would that be feasible?
We have a very large presence in Delhi. We have a second corporate head office in Noida. So I do visit Delhi quite often, and I'd love to come and visit IIHMR Delhi and interact with ignited minds on the campus.
So it's an open invitation. Just let us know whenever you're here, please.
Wonderful, wonderful. I'll take your coordinates from Manishji and Raghav, and I'd drop you a note whenever I'm in Delhi.
Right. Thank you. Thank you so much.
Thank you very much.
So the last question. What does Vision 2030 for Innovolution spell out?
Vision 2030 for Innovolution is to democratize cardiovascular access and care in those parts of the world where today, people are dying because of lack of availability of a cath lab. We had a mission in India that by 2030, all 780 districts of the country should have a cath lab. Today, we started that journey in 2018 with just 400 districts having a cath lab. Today, over 600 districts have a cath lab. By 2030, I'm sure every district of India will have a cath lab. Now, for a country of Nigeria's size, 250 million people, they have only 20 cath labs. Imagine. They lose close to 8 million patients every year because there's no treatment available. So African markets, Latin American markets, some of those underserved markets are a huge priority for us. By 2030, we want to be seen as a company that has played a small role in democratizing and enabling access to cardiovascular care in large parts of the world.
Wonderful.
Amazing, sir. Very insightful. I'm totally pumped up by hearing all the great plans.
The last question, thereafter I'll not. Okay, so that's something I know that you are a cricket buff, right?
Sorry?
I know that you are a cricket buff. Yeah.
Right.
So which format you like actually? Is it test match? Or how do you change, calibrate your strategy? Test match, 50 hours, and say 2020. And which one is your favorite?
In my opinion, I'm a fan of those cricketers who are successful in all the three formats.
Okay. Well said.
I mean, one of my bosses very early had told me that in life, it's not the sharpest people, it's not the most driven people, it's not even the most ambitious people who are at the top of the game. It's the most adaptable people.
Yes.
And I've always kept that piece of advice with me. In a storm, while an oak tree looks beautiful, but it's the reed that survives. So I think
you're also giving a tip to Ajit Agarkar. head national selection team, and I think he must adhere to.
Not really. I mean, I think you see adaptability and consistency. You had some brilliant talent like Vinod Kambli. Vinod Kambli was a
Audience,
fireman.
I have taken the recipe out.
Yeah. So
I
thank you very much. Yeah, I like players who can excel in all the three formats. Somebody like Virat Kohli.
Yes, yes, yes. Well said. Fine,
Very well.
Raghav. And yeah, over to you. I'm done with.
No, very well said, sir. I'll just do a final call for any questions or thoughts from anyone. I think this has been very enriching dialogue. Any questions, thoughts? Anyone would like to unmute and share or type in chat
Somebody has
box?
asked a very interesting question: unicorn versus cockroaches. I don't know if it's a statement or a question. So
No, absolutely no, sir. It was great to have you on the panel today here, sharing this exciting story, and I'm more excited with the path ahead as well. Will be
Raghav, one small correction here. It's unicorn versus popcorn.
unicorn. No, very well said. So we'll maybe come to the conclusion. I'll request Dr. Pankaj to share a few words, and we'll close this session with that and share details about the next session.
So it was a pleasure being here. I said that in the beginning also, and really very insightful, sir. And it's what I realized is that probably passion drives everything. So I think your passion to actually change the cardiovascular landscape, probably that has been the pumping factor behind this. And you've been doing some really amazing things. And I wish the students here or lifelong learners like me, we can take something out of this. And hopefully, we would like to see many more companies who can actually strategize this well in healthcare and probably be a game changer. As you rightly said, probably what pharma was there in 80s, now it's more about health informatics, health IT, device industry. I think they should pick up. And best of luck to you, sir. And you have been an inspiration. And thank you for this insightful session. And please keep in mind the open invitation I gave you. So whenever you're here,
I'd
right?
love to. And whenever you're in Bangalore or in Jaipur, even for the students of IIHMR Delhi, if they'd like to make an industrial visit to any of our facilities, we would love that with open arms.
Great. So thank you once again, sir.
Thank you very much. Thank you for having me today, Dr. Pankaj, Manish ji, and Raghav. Thank you very much for organizing this. Thank you so much.
Thanks a lot, sir. And thanks everyone for joining. And this was a very important sneak peek about what being at forefront of medtech industry look like and what's the journey to get there. Thanks again, Gaurav, sir. And with that, I'll just share details about the next session we planned for 18th May with Dr. Suchin Bajaj, who is founding director of Ujala Cygnus Healthcare Services. And he has been a leading pioneer in this space. The topic would be coordinated strategy for health hospital infrastructure with specialties and sustainability, keeping in mind on those parameters. So I'd like to invite students to join for that. If you have registered for today's session, you will get an email link to register for the same session. And with that, we'll close the session. And thanks again, everyone. And thanks again, Gaurav, sir, and Dr. Pankaj.
Thank you very much. I truly enjoyed the interaction, and all the very best to all the students. Here's a student with 30 years of experience, and I hope that all of you pursue your passion relentlessly, and you can surpass the little success that some of us have had in this space. All the very best to you. Thank you.
Once again, thank you so much, Gaurav ji, Dr. Pankaj, and all participants, Vineet ji. Thank you. Looking forward to more engagements in upcoming sessions. Thank you.
Thank you.